We've seen the popularity of weight loss drugs like Ozempic, Wegovy, and Mounjaro skyrocket. These medications are meant for long-term use, but some patients may stop taking them because of side effects, cost, and accessibility, or if they've actually reached their weight loss goal. Problem is, once you stop, it's common to actually regain the lost weight. So, what should you do and know? Let's ask the expert. Joining me now is Dr. Sonal Haerter with Dignity Health Medical Group, and she's also board certified in obesity medicine. Sonal, this has been dubbed Ozempic rebound. Why is it that some people who, have stopped the drug then gain it back, and sometimes even more?
Right. So here, obesity is very complex. It's not just lifestyle and eating habits, but we know that there are about 50 genes that can contribute to obesity, right? The way these medications work is they actually do few things. One is they reduce the food noise, which is cravings. Some people have these cravings that they just cannot fight, and these medications are known to reduce the food noise, decrease cravings. They also slow down the digestive process, so the food kind of goes very slowly, reducing cravings again, and thereby reducing portion size. So these are two very effective ways of how people reduce overall calories. Now imagine if you take that away from the patients, that comes back and calories go up. And some of these obesity syndromes are related to genetic predisposition. So just like any other chronic disease, like hypertension and diabetes, some people need these medications in long term, and we have to destigmatize using these medications for certain patients.
Right. Okay, but here's what's concerning to me. When you stop, or actually, no, I should say the opposite. If you don't stop, you say this is long-term, but what about the long-term consequences? What is that?
Sure, and so we know these medications have been around for 2 decades or more. We have known about these medications since 2005 because we have used them for diabetes. So we have enough data to know what the long-term consequences are. Some of these consequences like nausea, vomiting, constipation, GI discomfort is actually in the beginning, and patients do get used to it. We have ongoing studies that are looking at what happens if someone takes it for obesity for over 20 years. We don't have that information yet, but the medications have been around for over 2 decades. So they're not necessarily new to the medical world.
Okay, so let's just take out, you've reached your goal, that aspect of it. But for those who just can't afford it because it is so expensive, or for what have you, whatever reasons, if they stop, I mean, then what?
Right, and that's a great question. I'm so glad you brought that up. We do actually are challenged by accessibility because I have so many patients who can't even get it because pharmacies don't have it at this point. So here's what I want our viewers to know. These medications is not a substitute to lifestyle modifications and behavioral changes. What we know is patients who actually work on changing behaviors, like working out, resistance training, improving your muscle strength, eating adequate fiber, probiotics, and protein, actually have an easier time coming off the medications, getting the dose down, and actually doing it a little bit more lifestyle-based than on medications. So that's essential. That's 50% of the battle. This is not an easy pass. So even when you're on medications, these behavioral modifications are essential.
You still need to do it.
Absolutely.
All right. Thank you so much, Sonal. So important.